Hey guys, it's Becca Hayes again with the Good Girl Don't Give a um, This is the sequel of the first part. I talked about the O shot, and I talked about my experience. And if you didn't catch that, review that. It's on the YouTube. But today I'm here with Raquel. We're going to introduce her in just a minute. We're at the Aesthetica Plastic Surgery Center and Medical Spa, and we're going to get the medical side of the O shot. Raquel's going to talk about all the benefits of the O shot. She's going to go into who's a great candidate for it. So we're going to get more of the medical side, which I'm super excited about, and I'm so grateful to be here and get to talk to you. Okay. So go ahead and just kind of tell us who you are, and you just go, girl.
So Becca was the winner of our giveaway, our ladies event. Lucky Becca. That's where I got to meet her, but I'm going to tell you guys a little about me. I've been working in Aesthetica for a few years. My background is in labor and delivery and in surgery. I worked in the operating room, and I was the specialist for ENT, plastics, reconstructive plastics, and facial trauma. And I love Dr. Cross. He's wonderful. He's the one that got me into working here and treating vaginal health issues. So we treat that with both the FemmeTouch procedure and the O shot. So yeah, we'll talk about those today. I just want to ask Becca some questions, just see how her experience went. That's okay with you?
Oh, definitely. Oh.
So was it painful? What did it feel like?
Okay, so my biggest concern because I never even heard about the O shot. My girl told me about it because she has a membership here, which she absolutely loves this place. And she's like, girl, you got to come down here. They're going to give away the free O shot. So I'm like, well, what's an O shot? She's like, no, this is like the best orgasm of your life. And I'm like, okay, I'm down. So I came here. Yeah, so I didn't even know that existed, which I think this is super important for women to know that this is out there. And especially having trouble having orgasms, and you're going to get into all the other, there's more benefits than just orgasms, which this is why I needed Raquel to explain this. But my biggest concern was like, okay, you're injecting me down there.
Sure.
Like, not just a little bit on the lips, but we're talking about the G-spot and, the clitoris. And I was nervous. I mean, I know I've had 2 kids, but I was nervous. And that was my biggest concern. I really like that it's basically organic, because you're taking our blood, my own blood, and you're putting it in, what is the spinner called?
So it's a centrifuge process. We do the Magellan. The system we use is the Magellan. It's a dual spin. So it gives us the highest, most pure concentration of PRP. And for those of you that aren't familiar with what PRP means, it's platelet-rich plasma. And what that has is tons of growth factors. So, for example, a lot of people know when they skin their knees as a kid and they see that stuff, that gooey, slimy stuff, that's your PRP. That's coming to heal and regenerate the tissue.
Oh, so that's some good stuff.
Yeah. So I'll give you a bit of background on PRP. The first time I ever used it was actually in surgery in the operating room in orthopedics.
Oh,
we're doing total joint replacements, and the rep was there, and this was this big new thing, and it's been about over 10 years ago, which kind of dates how old I am. But anyway, that's when I first did it, and so they did it for the joints. I was like, oh, that's so cool. It helps with recovery time, helps just with the whole healing process. And in 2011, Dr. Reynolds is the one who did the first O shot. He invented the O shot. It was his girlfriend, actually, that's a long story. You can read his book if you want to hear all about that. But he did the O shot on his girlfriend, and she had wonderful results. What we do is with PRP, it has growth factors from where we inject it. So when you put it in the knee, or if you put it in the elbow, or if you put it in the vagina, that's where it's going to tell the body, okay, time to grow and regenerate tissue. Okay. So that's kind of a little background on how it works.
You don't add anything to it.
No, it's all your own body.
Which is so awesome.
So
it's organic, you guys. And so that's what, I'm pretty much all organic. I mean, okay, I got some implants, so let's be real, but that was besides that. But I really am pretty much organic. And so when I heard that it's just your own blood going back into your body, obviously, the good stuff, I was okay with it. And I was like, all right, this is awesome.
Yeah.
And so that was my biggest concern, was the injections, but you numbed me prior, so they put this numbing cream on for about 15 minutes?
20 to 30 minutes.
Yeah.
So start with the numbing cream, because we want you to be, down there it's very sensitive, so we put the numbing cream on. What I like to do is I do the numbing cream first. I do a vaginal exam and make sure you're a good candidate before I go through this whole process. Yeah. And then while you're numbing, I then drew your blood, because it takes about 15 minutes to do the centrifuge process. And then we just get to work, so yeah. But before we get to the injections, so she has a numbing cream on for, like I said, 20 to 30 minutes.
Yeah.
Then I do a numbing injection with lidocaine, do a clitoral block, so you don't feel pain there. And
extra.
And ice before I even do that too. So truthfully,
covered everything.
Yeah. I give every angle of numbing that we can, so to make it more comfortable.
I seriously did not. I think the first injection. Where did you inject me first? It was like a tiny, tiny little pinch. Honestly, though, I could barely feel anything.
So the first injection was in the clitoris itself. That was the lidocaine.
This is for numbing.
The numbing injection. Then I let that sit for a minute, and my assistant holds ice back up to that. And then the second injection I do is so it's in the periurethral space. So at the anterior wall of the vagina. So it's just right at the very opening of the vagina. And that helps with stress incontinence and orgasm too. So we inject there, and then I can inject a little bit further back to help with sensitivity. So it's pretty customizable to each patient, and you fill it up. And what will happen initially is you won't see results. Becca saw great results initially. Some patients, it's kind of like a roller coaster. You'll have great results at the very beginning, then it goes down, and then it comes back up. What your body helps regrow and regenerate that tissue.
Yeah.
So you might notice the next few weeks, like, oh, it's not as good as it was.
Well, I got a story to tell you.
Oh,
yeah.
Your story.
Well, real quick though, I want to talk about how you customized it, because I think that was awesome. Like I've had two boys, no girls, but 2 boys. I love them.
Hey,
love
me
them.
too.
Right? Boy, mom. And I love working out. I do fitness, but I cannot do jumping jacks without peeing my pants. Mm-hmm. And I kid you not, and what I loved about Raquel, like you asked me, like, okay, when you like jump, do you pee a little bit? And I said, yeah, like, and I hate it. It's so annoying. I tried to do a high fitness class and like literally was just soaked. I mean, I walked out and I'm like, it's sweat. But no, I was like peed my pants. But I've noticed now I actually can do burpees and jumping jacks now, and I haven't had a problem. As long as I go to the bathroom right before, awesome. I think it's so awesome that you can customize that.
Yeah, so when women come in, so we offer different treatments at Aesthetica to help with women's health issues, and we do the FemmeTouch procedure and the O-shot, and some women do just one, or some women do both together. And what I really like about the O-shot is if patients have issues with sensitivity or if they have stress incontinence, I can kind of adjust the volumes where I inject. So that's what, like, you're saying how I customized it.
Yeah, I thought it was
gives
so
you
awesome.
long-lasting results too. So.
Oh yeah. And another thing that was on my mind. So obviously there's other benefits than just great orgasms, and then a little bit of like the customizing. Like, what was it that you were saying? Like, what does it help? Like long term.
Okay, so the shot itself helps with. I tell patients. I know I keep bringing up the FemmeTouch, but they kind of go hand in hand. So,
and explain what the FemmeTouch is for people that don't know.
So the FemmeTouch is a CO2 laser treatment that we do to help rejuvenate the vaginal tissues. A lot of people ask me, like, am I a good candidate for this? How do I know if I'm a good candidate? Honestly, any adult woman is a good candidate, but women that have vaginal dryness, pain during intercourse, an ability to achieve orgasm or have multiple kids and feel like it's just really loose down there. Honestly, any kind of issue you could think of with the vagina, people benefit from. Okay. I have some patients that can't take hormones, and those ones are the ones that this is like their only option to improve that. So I had this one patient who had gone through breast cancer, went through chemo. She said, I survived, and I was all happy and like ready to start being with my husband again because I was healthy enough. Then I felt like just sandpaper. So then I couldn't even have sex with him. I had gone like all this time being sick and trying to get together. So that helped. The FemmeTouch and the O-shot helped her because she had all the issues. But we start with the FemmeTouch, and that helps with moisture production and it helps with over time you get laxity in the vagina, and it can become more rigid and isn't as pliable as it was when you were younger. So it helps with that, and just helped her just get back to having a normal, healthy vagina again.
That's awesome.
Yeah, it's great. And then with the shot, we then took the next level with the shot to help her be able to achieve orgasms. And what the shot helps with isn't, I told them, you have to do your homework on your end too. Like, I'm not going to make, it's not a magical thing.
Kegels? Is what you're talking about? Kegels?
No, I'm just saying, like, mentally, sometimes for women it's harder. Like, I'm not going to make all of a sudden the frog become Prince Charming when you need the shot. It has to be like, I'll help you with the mechanical things, but you still have to meet me halfway.
Yeah, yeah.
So,
totally understandable.
As we get older, or even...
I mean, you have to have a good-looking dude.
Yeah. or just nice or whatever. I'm joking. But so what that does, it helps with sensitivity and just the tightness with the O shot. So that helps just with the orgasms. I told women, if you've had them before and they've been great before, I'll get you there again. But you also have to meet me halfway.
Yeah.
And what it helps, what the studies have shown, is that it helps you get to orgasm quicker, and it lasts longer, and it's stronger.
How long does the O shot last?
So the O shot lasts about 12 to 18 months, and it's for the sexual benefits. But for the stress incontinence, it's a lot longer lasting.
That's awesome.
It's hard with stuff like this, the autologous treatments, because it's our body healing itself, so you don't have a study group. So it's a lot longer to get data to support, like, oh, it's going to last this longer, this is when you need the touch-up. But the company recommends 12 to 18 months, and that's the same with the FemmeTouch. What we found is that when you do them together, the long-lasting results for stress incontinence are seriously, like, huge.
That's
Most
awesome.
of my patients that come back in, it's more for sexual benefits. The stress incontinence tends to last longer, and like I said, that's just what I've seen. It isn't technically scientifically proven yet, but that's common with most of my patients.
That's so great. So I need to update you, and I need to update you guys, because when I talked to you a couple weeks ago, it was probably, I want to say, a week or two after I received the O shot. And so I mean I had a great experience that night. Sex was great, orgasm was amazing, and that couple, and the thing is hard because my boyfriend lives in New York, okay? So it's not like, I mean, I guess there's other ways, but let's be real, like, I had a couple weeks where, I wasn't, like, trying it out and stuff. Well, third week, and he actually just left, he went back to New York, but the third week, I started, like, getting those vibes where I'm like, oh my gosh, I felt like, what's the correct term? I don't even know. Hornier. I mean, you know what I mean? Like,
sometimes not a correct term, but yeah.
I don't know what you would say. Like, I don't even know.
You were desiring.
I was desiring him, but no, I really did. I felt a little, And then he came into town, and we had intercourse, and it was great. Like, and prior to the O shot, I could have an orgasm. It would take me a while though, and I'd have to really concentrate. I would have to be in like a certain position, and like literally all the cards had to align. Like it.
Sure.
But this now, it's like it comes on a lot faster. Okay. We're going back to that. It lasted probably, and I'm not even like joking, probably a minute and a half. I've never had an orgasm last that long, ever. I mean, we're talking like, normally it's like 10, 15 seconds, if that. It was like minute and a half. So I'm just saying, like, obviously it works for me, but I know everybody's different.
Yeah.
Everybody's reacts different to the, whatever procedure it is.
Mm-hmm.
But for me, definitely a plus.
That's awesome. So what Becca might notice too is that, so she felt the initial results from the PRP. So you have the inflammation, and the blood is being recruited to the surface area from the injection. And then, like I said, like 3 to 4 weeks out, so about now, your body's now regenerating that new tissue. So you might be in for more surprises later. So
well, I'm flying to New York in a couple weeks, so
yeah.
I'll just keep you updated on my entire sex life for the whole year. Just kidding.
No, it's
kidding, but not kidding. Right?
No, it's actually like really cool. It's a fun nursing job to have, because a lot of times we're treating people that are sick, but something we can actually help people improve their quality of life, and just little things too, especially with, I know I keep harping on the stress incontinence, but
it's a big deal.
When you're at the
It's
gym,
a big
or you're ready to go to your workout class, and like all the moms are like a line in the bathroom, so everyone has to empty their bladder before the class starts.
Well,
so
I would empty before the class or before I do a workout, and it would still, I'm like, where is it coming from?
Sure.
Like, what the heck? Like, it frustrated me so bad.
And what's cool with that too is, with my surgery background in my head before I started doing this, I thought, well, there's the bladder sling, there's the suspension, A&P repair. But what's hard with that is it's surgery. And nothing against surgery. Some people need surgery. Not everything can be cured with this treatment. Most patients can, but there's no downtime. Like,
exactly. Well, why not give it a try? Yeah. Instead of like going straight to surgery, like give this a try.
Yeah.
Because if it works, then it's obviously a lot cheaper, and not as a surgery.
Yeah.
So.
Sure.
Is there anything else that you want to tell people that are like curious about looking into the O shot, or because it's a touchy subject? I mean, first of all, it's hard for women to admit that they have sexual issues in the bedroom or whatever. And some women don't even realize it's a problem.
Sure, and that's even what I've seen most of my patients. A lot of them will come in saying, oh, I have stress incontinence, and they get drawn in by that, but then after they've been treated, when I do my follow-up, they're like, oh my gosh, like I had no idea that it was that bad or something like that. So I just tell patients, just come into a consult. Consults are free, it doesn't hurt anything, and everyone's issues are different. Like I was telling you, like there's some people that say, you know, I lack moisture. Other people say, well, I don't have sensitivity, but what we're doing is we're fixing the tissue, right? The vaginal tissue, making it more healthy, stronger, and with the collagen production and the increased blood supply, it's just rejuvenating it. One of the examples I like to use with the FemmeTouch is we're almost like aerating a lawn with the CO2 laser. We're creating like little micro injuries in the vaginal canal, and with the CO2 and the new blood supply, it creates a new tissue. So it's a similar concept with the PRP. I'm injecting the PRP. When I inject it, that activates the PRP, and I actually use the activated calcium chloride. So let's say, like, back to the knee ski, like if you see your knee analogy, then your calcium levels will go up, so it recruits the platelets.
Okay.
But what I do with the calcium chloride is I inject just a teeny of that with the PRP, and then it just tells the brain, like, oh my gosh, fix this spot right here. It needs to be fixed.
Okay.
So,
no, I didn't get the femme.
No, you did not. No.
She liked my vagina. She thought it was really tight, which I
told her she has a healthy tissues down there. So every vagina is different, though.
Edit this. No, no, for real though. I was like, that was probably the best compliment I could receive. You know, especially having 2 kids. So I was like, oh, yeah. She's got me a best friend for life.
No, and everyone's different. That's what I was telling her. I said she's healthy. Her health is good down there. But Kegels are great, and then also with some women have had episiotomies or tears, and with the laser we can help heal that. And I had one patient. I won't say too much information, so I won't give her away. But she, like, honestly, her only issue was that episiotomy scar area. She said it just hurts. It's like when every time we try and have sex, it's like almost like I think in my brain, like, okay, relax that area. But I helped treat that scar with the CO2 doing external treatment with the FemmeTouch laser, and I did a PRP injection, and she said, oh my gosh, it's like fixed. So it's cool. Everyone's story is kind of different, but results are about the same.
And some women have a hard time riding a bike, right? And that's a good candidate for...
Yeah, for the external laser treatment.
Yeah.
Yeah. If their labia minora hang out a little too low, or if they're dry and thin, they should let it.
Wow.
And we can also inject PRP externally down there too. But I told you were good, so we didn't even venture there in your appointment. So as you guys can see, Becca loved her results. If you would like to learn more, please schedule a consultation with me, and I can teach you more about the O-Shot and FemmeTouch.
Give it a shot. Oh, did you guys get that?